Hey y'all, how y'all doing? Okay, so I shared a deep plane facelift neck lift result, and you have probably heard this term like deep plane over and over, and you're like, well, what does that mean? So I want to try and explain that as best I can today with my demonstration. Okay, so the first thing to understand about any part of the body is that there are multiple layers, right, and multiple levels. So in other words, there's what you see, but there's also what you see that's underneath the skin. So first layer is always going to be skin. Okay, so we got skin. Skin is the largest organ in the human body. Um, then we have our subcutaneous tissue, which is our padding or our fatty tissue, right? Cutaneous tissue, we then have our SMAS. And this is all, I'm describing the face right now. So our SMAS is going to be our superficial muscular aponeurotic system. What does that mean? It is basically, think about it like a fibrous network of tissue that basically kind of bridges the muscles of the face with the overlying structures. So that's the SMAS, right? So that's a layer you can actually see when you're doing a facelift and things like that. Okay, so we got the SMAS. We talk about SMAS. We talk about the muscles, and then under the SMAS, we actually have our ligaments, and then our bony layer, right? And so, wouldn't it be neat? Think about it. Wouldn't it be neat if you could just like have one layer that maybe you go under that layer and you kind of move as much as possible, right? So the way I think about a facelift is I think about it like this, like how much can we move at once, right? And also it's not just about tightening skin. It's about tightening the layers underneath. So I'm going to relate it to something I talk about a lot, which is tummy tuck surgery. So tummy tuck surgery, I do a lot of muscle work that's progressive tension sutures because I definitely feel like it matters. Tightening the underneath under the skin matters because it kind of helps keep everything toned and tight and supported, right? So let's go to the face. Same situation. You have the SMAS, which is basically, think about that like the connective tissue of the face. So in a deep plane facelift, what happens is you go under the SMAS and you release the SMAS. And so essentially what happens is you tighten all that tissue in a natural way, not in an abnormal way, right? Facelift should be natural, should look natural, it shouldn't be abnormal. It's really just about restoring things to where they should be. Why we do facelift surgery and why it comes about is because over time what happens is that you have weakening of basically your ligaments, including your mandibular ligament. And what happens when over time is that tissue kind of drops and falls, right? And you have what we call jowls. So what a facelift does is just tightens everything. But the subsmass or deep plane facelift actually tightens things really in the deep layers of the face so that you get tightening of your ligaments, your muscles, your skin, subcutaneous tissue. You tighten everything, right? And it's more sustainable to me, in my opinion, over time. Now, with that said, I'm going to be honest with y'all because I'm never just going to act like one technique is the only technique, the only way. You can do a facelift that's not deep and still get nice results, right? Studies have actually shown that results are similar between the two. And I remember talking to one of my mentors about this where I did my fellowship. So the neat thing about fellowship is that you go and you learn from people who have been doing this for 20, 30 years, right? You learn from the things they've done, the things they shouldn't have done, like it's an amazing experience. And I was so fortunate to have that. But I was talking to him and I was like, tell me about the deep plane, like why deep plane? And that's what he did. And that's, where I learned and who taught me. And he was, the way he described it is like, you just get so much more movement of the ligaments, of the muscles, of the skin when you go underneath that SMAS layer. And I have noticed this too in the operating room. When I'm under the SMAS and I'm just pulling just to see where things are, it's like the whole face moves and tightens, and it's just amazing, very natural. The SMAS is actually continuous with the platysma, which is the muscle in the neck, so you just get diffuse tightening. So that's really what a deep plane facelift is. If you've been seeing that and you're like, what do they mean? Well, the reason we use some of these terms is because it's easier for people to understand. It's more kind of simple terms, but that's kind of the technical terms about it. So I'll just demonstrate. So we have skin. Imagine you have your skin, right? We have our subcutaneous tissue, we have our SMAS, our ligaments, and our bone. So right now I have the SMAS layer, okay? So how neat would it be? Like, you imagine you tighten the SMAS. Look, all this moves. Okay, so you tighten the SMAS. Wait, we got movement of our skin, our subcutaneous tissue, our ligaments are all moving and tightening. Why? Because they're all continuous with the SMAS and you're lifting it all. So to me, it just creates such a durable, sustainable result. Okay, y'all, more to come. Y'all have a great day. I'll catch y'all later. Happy Tips Tuesday.